Hey everyone, and welcome back to HWL Talks. Today's episode number 4, and my name is Trevor Strauss, Senior Vice President here at HWL, and I'm fortunate to be joined by a up-and-coming, might be the wrong way to word this, but an amazing CEO that I've had a chance to get to know over the last year, and Aidan Hettler. And Aidan, when you came into this, you were the youngest CEO in the country, right?
Yep.
For a hospital? Yeah. That ripe old age of 22 when you came in. I think maybe though, now we might have somebody who's been able to supplant you. I kind of doubt it, joking, but we're excited to have you. I mean, I'm excited to build on some of the discussions you and I have had as well, across the last year. And so why don't you introduce yourself to the audience, since not everyone's going to know you from all the press releases that you got when you did become the youngest hospital CEO in the country. But tell us a little bit about your backstory, how you got here, a little bit about the organization, and then we can dive in.
Yeah, thank you, Trevor, for that intro. It's a pleasure to be here, and always nice to chat with you and carry on the great conversations that we have with one another. So, I took over as the CEO at Sedgwick County Health Center in September of 2022, and as you mentioned, I was just 22 years old, which was crazy and different, and did make a little bit of a splash in the healthcare world, and was unconventional, but it's been a fantastic journey for me, and an amazing opportunity to lead a great team of people taking care of a wonderful community of folks out in the northeast corner of Colorado. We are a small but mighty rural healthcare system that is comprised of a 15-bed critical access hospital. At the time, we had 2 rural health clinics. Now we have 3 because we did open one a year ago, which was really exciting. And then we've got a nursing home and an assisted living as well. So all of those are kind of what makes up our system. And we say that with kind of some fire and intentionality, because it's, of course, so much smaller and different than what you see in urban settings and even suburban settings. But it makes up the web of care and what we're able to do out here in rural areas. And that access is really important to the communities that we serve, and driving that backbone of America that is the rural and agricultural communities. So it's been a privilege to serve, and I've been in the role just about 2.5 years now. So,
Well, that's outstanding. I mean, the work that you're doing in, critical access hospitals in the rural markets is, like you said, it's vital. How large of a service area do you provide care for?
Yeah, so our county, because we're Sedgwick County, the population is about 2,500 people, but we actually are multi-state. So we have 2 of our 3 health clinics are actually across the border in Nebraska, in Dual County. So we have reach over there as well. So everybody always likes to ask, how many people do you serve? It's kind of hard to get a firm number on that. We know what our visits are per year. Unique visits are around 12,000, clinic visits, 17,000 outpatient encounters, so on and so forth. So those are, some numbers, but we have folks that travel, sometimes an hour and a half or even further away to get care from us. And that's not because they don't have care closer to them. It's because they like the care that we provide, and that's a huge honor for us to be their providers of choice. So we really like that, and it's been really exciting, especially as we opened a new location and kind of pushed a little deeper into our regional service area, but are starting to meet new people and provide care to areas that didn't otherwise have it before.
Well, I think that's great. It gets me thinking back to one of our first conversations, because shockingly, we dove right into people, right? And, workforce and all these different things. We went down about 6 different paths, but something that really stood out to me in that discussion was really your leadership style, and thinking about that from everything from meeting staff where they are, the inclusion of the staff, because like you said, you're a small but mighty team. And so you've also done it all. You've also been in the kitchen, right? You shared some of those stories. I hope I'm not sharing anything too personal, but you've lived every role in the roles that, of course, that you can serve. So I think what would be really interesting for the audience would be to hear a little more about that mindset that you have from leadership, from dealing with your teams, from engaging your teams, and really driving the inclusion of your teams.
Yeah, I appreciate you touching on that, bringing it up. I would like to think that my vision for leadership and leadership style as a servant leader has been a hallmark of everything that I've done here under my tenure, and will be something that people remember about me long after my time in this chair too. But in rural healthcare and in all healthcare in general, we're serving people, and we are also teams of humans provisioning that care. So at the heart of everything we do, it is people. So I, personally just enjoy being a servant leader. My view on leadership is it's my duty to show up every day to help my team do their best work, have the tools that they need to provide the best care, and generate the best outcomes that they can. And really, you asked a little bit about what my journey was coming into this position, and I've been fortunate to share that story with folks like you and people through other podcast mediums. But when I interviewed for this job, I didn't have any formal healthcare experience, which again is crazy to so many people and was crazy to me at the time. But the thing that I knew was that I wanted to serve teams of people, and empower them and embolden them to do their very best. And although I didn't know all of the mechanics behind healthcare, I felt like I could connect with people at a base level. And that was my promise to the people who were interviewing me, which was my board and all the department heads at the time. And, that really resonated. So because I didn't have all the technical skills, they knew that I could get there. And, that meeting people where they are principle was really reciprocal. They were able to do that, they being my team of, leaders all the way down to the front line, met me where I was, as someone who was fresh out of college, but, had deep leadership principles and being a servant leader and wanting to seek to understand their day-to-day functions to figure out how we could make things better. So they took me on a learning journey with them, and I conversely taught them what I knew. And I feel like we have this fantastic kind of symbiosis that has prevailed, for the 2.5 years that I've been in this role, and will continue to be that way. So it's just been great. And it's a privilege really to be a leader. And I think that's the cornerstone of servant leadership is the privilege of it, and being here for all of the people that you work with. So,
well, it may even surprise some of the listeners, but you also have a very diverse workforce, and you have people that need to feel included that maybe didn't always feel that way. And, that is something that when you and I have talked, not only leads to how you deal as the CEO at Sedgwick, right? And your people, but it's also how you look at patients. And one of the things that you and I talked about, and we're going to get to the relationship-centered care component, but something really hit me in one of our conversations, because we were talking about, patient-centered care and all of the things. And, you said, well, one thing that we always think about here is that a non-compliant patient, and like on a checklist, right, on that process, is just putting them in a box. It's just kind of checking that box for them. They weren't compliant. They didn't take their meds. And so now they're coming back because of their diabetes or obesity or whatever it is. They were a non-compliant patient. But that's not always the full picture. So it led us to start to go down this path of you educating me much more on relationship-centered care. And so why don't you share that with the audience? Because while it was newer for me, it may not be for every one of our listeners, but your passion behind it and what you've done as a leader with your teams and for the organization, I think is very, very big.
Yeah. So I want to give credit where it's due. I was fortunate to go through a master's program at the University of Texas, Austin, which was a master's for healthcare transformation program, which was a small cohort of incredible folks. Some of us from healthcare administration, many of the crew were physicians, if you will, who were on the front lines of provisioning care. And through that program, we learned a lot of the principles of value-based care, and how do we take the standard practice models that we have today that dominate healthcare delivery service in the United States and move to a more value-based system. And relationship-centered care was at the root of that. And really, relationship-centered care just recognizes the quality of the relationships at the center of provisioning care and how that influences health outcomes. So I brought that back, to my team and challenged them to think differently. And the non-compliance piece was just one, example, but it's a powerful one in that, so often, especially in populations that we serve that have a high prevalence of, chronic conditions that we manage that can be somewhat hard, people may be quick to say, this person's just, they're not taking their medications, or they're not doing this. Like you mentioned, they're quote unquote not compliant. Well, there's so much more to unpack to that situation. And that's where relationship-centered care really kind of steps in and can make powerful impacts in how we can change positively the provisioning of care. So relationship-centered care focuses a lot on, cultural competencies. So for our team, it was having everyone from clinicians to MAs to nurses to other team members focus on, understanding the underlying factors that drive patients' everyday lives. So whether that's, social determinants of health, whether that's cultural things that are important to folks, racial factors, all kinds of things. There's a lot that goes into making a patient who they are, other than just checking the box, right? So you want to take things a step further and really seek to understand why people exhibit the behaviors that they do. And cultural competency is a really big part of that. And I want to also, just while we're touching on this topic, I don't want to give anyone the false impression that we do this perfectly. Like, no one's going to come and say, oh, Sedgwick County Health Center is a perfect case study on this. They're flawless, they're perfect. This is all a work in progress for me and my team, for my clinicians, for myself. We are working to make ourselves better at all of these things. And it starts with conversations and education and, teaching back things to your team. So I just want to stress that too, because I think so many people listen to, things on social media and podcasts like this and think, oh, well, here's this idealistic place and they do it all perfect, and I don't know how we're ever going to get there. Change is iterative. Take one step at a time, put one foot in front of the other, and see what change comes of that. So I just wanted to put in that piece there. So in addition to understanding kind of the cultural driving factors behind patients, we also look for how we engage patients in the conversation differently, so making them an active participant in their care conversation. So that, it can be as simple as thinking about how your care team shows up, whether it's in the hospital or in the clinic, is that, having open dialogue in front of the patient in the hospital room or in the exam room. People may have a natural inclination to, and people being, part of the care team, stepping outside of the room to have conversations when you may inadvertently be excluding the patient from something that they need to be a part of, and that may make them feel really uncomfortable, even though that's not your intent. So we have a lot of conversations around why that engagement piece, and that also ties into our effective and empathetic communication components as well, are really important, because when the patient feels like they're part of the care team and part of the decision making in the moment and not afterwards, it's so much more effective at provisioning positive care and gaining positive outcomes. So it's just a whole different approach that we really like. And then also just interdisciplinary collaboration. So we always talk about that in healthcare delivery, how, convening the interdisciplinary team is the best way to, get good health outcomes, and, having your case manager involved and your doctor and your social worker and you're this person and you're that. That's talked about a lot. And, everyone, I think, typically would agree that is the best approach. So that's, of course, something that we strive to do here. And I think we're fortunate because we are a smaller, more tight-knit system. It lends itself to being easier for us to kind of get all of those players at the table. Not always. We definitely have our mistakes, but by and large, I think we're able to get the team kind of convened and say, hey, we do need input from this person. We need our director of rehab here. We need case manager. We need our CMO. We need all our folks. And you can produce better clinical outcomes that way, and really get to the heart of what the patient needs. And then we also look at things through the lens of patient capability, comfort, and calm. There's so many driving factors for patients that really matter to them, but when you bake it down, and this comes from Elizabeth Teisberg and a lot of her work in value-based care, capability, comfort, and calm are the three main factors that no matter what, when you take away all the complicating parts of care delivery, that's what really matters to the patient. When they're going through a care episode, how is this going to affect their ability to do the things that they really care about? Comfort, are they going to be in pain? Will they go through an acute treatment process, or, even a minor procedure or something like that? And then calm, if it's a chronic condition, are they going to be able to enjoy their life if it's something they're not going to escape, and so on and so forth. And you can unpack those so much deeper than what we will in this quick conversation. But just as a quick intro for listeners, it's really powerful when you distill things down into just a few concepts and how that can affect how care is delivered. So anyway, that's a little bit of how, relationship-centered care has taken root in our system and how we're trying to shift everyone's collective mindset to that style of delivery. So it's good.
Yeah, I think it's great. Obviously, it resonated with me because as you've gotten to know me, relationships are very important to me. It's the world of healthcare is the largest small world ever. Yeah, everybody knows everybody. Everybody's connected to everybody, and this is a relationship business. And one of the things that I was most impressed about as we've been getting to know each other with you is, and I'm sure the listeners could see and hear it in your description here of RCC, is that this is clearly just in your DNA. You are a relationship person, you're a servant leader, and you take that in all facets, which I think is fascinating for any leader, let alone a younger leader, not just in age, but even in career, right? It's lessons learned that sometimes take the hard mistakes and missteps that you've clearly gotten in front of with this idea and put passion behind and gotten your team mobilized on. And it kind of leads us a bit towards more of like those ideas and thought topics and things that maybe not everybody thinks are as pressing in smaller communities. But when we think about DEI, right, there's a lot of topics. It's a charged topic at times. The reality, though, is diversity, equity, inclusion matter. And what we're trying to, what you and I have spent time talking about is using that in every way, from employees and staff to also patients, and ensuring their equitable access to care and getting some of the things that you just covered a little bit in RCC. But I know you also believe that this component within, DEI framework, or at least thought process of being extremely inclusive and equitable, has a real impact for the future of healthcare. So I think that's a good place for us to unpack next and probably wrap us up today, even though I know we could talk about it for a good solid hour and a half, 2 hours. So why don't you share some of your insights there?
Yeah. I think, like you said, DEI, of course, right now is something that is really charged, and there's a lot of strong emotions towards it on both sides of the spectrum. But when you really break it down and think about it, DEI fundamentally is healthcare. We're provisioning care to people who need solutions to care issues, and so we're segmenting that. So other than preventative care, where we're working to keep healthy people that way, or maintain conditions, a lot of healthcare is reinforcing the principles of diversity, equity, inclusion, and belonging. So just tying it back to our conversation about relationship-centered care, that's inclusion. It's very simply including the patient in that conversation about care decision making, both physically including them in their presence, like we talked about in the exam room or in the hospital room. It's emotionally including them to understand their wants and desires for the outcome of treatment with capability, comfort, calm. It's inclusion. It's a component, and there's nothing to be supercharged about with that. It's just a fundamental part of healthcare delivery. And then, equitable access and creating equity as part of healthcare is really important too. We have a duty in healthcare to make sure that, those in this country, regardless of your economic status, your race, your location, your zip code, especially, I'll touch on the zip code one, because we always say in rural healthcare, where you live shouldn't determine if you live. That's, Kevin Stansberry line that he touts often. We need to make sure that there's equitable access to healthcare, and rural healthcare is a huge part of that framework. If we weren't here, there would be a huge gaping hole in the equity puzzle of the healthcare continuum, because people in a large portion of the United States simply wouldn't have access to healthcare. So we're part of creating that equity, and there's, again, nothing to really be charged up about that. We're just making sure that, if you're a diabetic, I have a doctor that you can come see, or if you have the sniffles, you can come here and we'll take care of that too. Or conversely, if you're having a really bad day, RER is here as well. That's creating equity. And diversity too, in our practices, it's just really working to understand that, there are people with different views, different walks, different understandings, different perceptions, different relationships with things, and making our health center, at least for us, a place where, everyone is welcome. This is a place, this is a safe place for people to get care. And that is our mission, and that is what we are here for. And I think that's what, we ultimately say all healthcare institutions are for. The Hippocratic Oath is to do no harm. And, diversity with that is creating the spaces that are equitable and inclusive and allow for diverse people to go there and receive healthcare. So that's why when I say, DEI and DEIB is healthcare, it really is. It's the foundation of it. And just to put it to bed one last time, there isn't really anything to be charged about that, in my opinion. It's just at the roots of what healthcare is and what we're all here to do. we're here to take care of one another. It's people taking care of people at the end of the day.
Yeah, I couldn't say that any better. I mean, that's what we're here for. We're here for the patients, to make sure that when you have the emergent moments, when you need that care, when you even just need your preventative care, like, we're here, and we're all serving that mission. I can't really name a person that I've gotten to know in the last almost 20 years in the business that didn't get into it for the patients in one way or another. Even for people like me and you know, we're not the clinicians at the bedside. But at the end of the day, it's really clear why you and your teams have had so much success. I was excited to have you on here today to share some of these ideas and some of your vision that I've gotten to know over the last year with our audience, and wishing you continued success. And I know it's going to come. So really appreciate having you here today, and we will talk again soon.
Yeah, thank you so much. It was a privilege.
Thank you. Thank you all again for joining us here on HWL Talks, and I hope you enjoyed Aidan's episode today, and that you will continue to follow us as we talk to more healthcare leaders and innovators from across the country. It's exciting times ahead, and we look forward to having you in our community. Talk soon.